improving the care of children and families while supporting pediatric practitioners of all types across the state. Our chapter is a very active one. We have a strong focus on advocacy work and work with key allies and partners to leverage our impact to continue to support and improve high-quality pediatric care delivery across our state. Here in Washington, we are very fortunate to have some incredible pediatric experts among us. The chapter has been working to find ways to best connect this expertise to pediatric providers and the greater community across our state. One mechanism has been creating webinars on pertinent topics chosen through member feedback. This morning, I get the pleasure of introducing Dr. Fred Rivara. Dr. Rivara is a perfect example of a renowned expert here in our state who is a leading researcher and advocate, particularly around injury prevention and childhood safety. Dr. Rivara earned his Doctorate of Medicine from the University of Pennsylvania, and then after that found his way out to Washington and to the University of Washington. Dr. Rivara has, since coming here, has founded the Harborview Injury and Research Center and also the International Society for Child and Adolescent Injury Prevention. He is the Vice Chair of Pediatrics in the School of Medicine and the Chief of the Division of General Pediatrics, as well as the Editor-in-Chief at the Journal of JAMA Pediatrics. The number of awards I could list off is too lengthy to list. He has made many important contributions in the research around gun violence, among other topics around injury prevention and child and adolescent safety. He is a friend of the chapter, and we are grateful to have Dr. Rivera doing our webinar this morning about the role of a pediatrician or a provider that takes care of children in firearm injury prevention. After he's done, there will be an opportunity to ask questions. So without further ado, here is Dr. Rivara.
Thanks very much, Julian, and thank you, Julian, for also taking leadership in the state, working with the legislature to try to pass some gun legislation here. It's really a distinct pleasure to talk with you all. As Julian said, I've been involved with this area for many years, over 30 years, and want to basically give you some information to help you be better informed about the whole problem of gun violence, as well as what you can do in your practices, because I think that we, as pediatricians, play an important role individually with our patients as well as on the state stage in terms of advocacy. And the action is really all at the state level. There hasn't been any congressional action in a long time related to guns, and unlikely to be in the current political climate. So let's start with this slide. And this is, to me, a really incredible slide. The fact that we have had more Americans die from guns on our streets and homes than have died in all of our nation's wars over the last 45 years. And the fact is that we've had including the 9/11 attacks on the United States, we've had many, many more people have died from guns since the period of time than have died from terrorists. And just to put this up because it really, to me, struck home this week in 2015, almost 2 years ago now, when you all remember that individual who shot and killed 9 people at a church in Charleston. The next day, an NRA board member blames Reverend Pinckney, who's one of the people who was killed and who was also part of the South Carolina state legislature, and blamed him for his own death because Reverend Pinckney had opposed loosening gun control laws in South Carolina. A few days later, Scott Walker signed a law in Wisconsin that repealed the state's 48-hour waiting period. And then once again, excuse me, somebody should probably mute their phone there. There's a lot of side chatter there. Anyhow, Congress had once again voted to keep and ban the now almost 21-year ban on CDC funding for gun research. It was put in place in 1996. And to give you an idea of what is possible, just look at the problem of motor vehicle fatalities. There's been a tremendous reduction in motor vehicle fatalities, an 84% reduction in motor vehicle fatalities over the last 60 years. And that just shows that when we set our minds to doing something, we really can have an effect. And here are some of the things that was responsible for that decrease in motor vehicle fatalities. We all remember Ralph Nader, but Ralph Nader in the early part of his career actually did a lot of good. His first publication was Unsafe at Any Speed, about the Chevy Corvair and how that was really an unsafe vehicle. And that alerted Congress and members of the Johnson administration to really try to do something to make cars safer. So President Johnson in 1966 created the National Highway Traffic Safety Administration, which oversees safety features for motor vehicles. And you can see that over the next few years we had important regulations that made cars safer. In 1978, there's a pediatrician in Murfreesboro, Tennessee, Bob Sanders, who was responsible for the first car seat law in the United States. And then 6 years later, the first seatbelt law in the United States was passed. And then in 1989, after much opposition by motor vehicle manufacturers, driver airbags were required. And you can see that there was subsequently all further regulations to make cars safer. And all states except New Hampshire have a seatbelt law, and you can see New Hampshire's state motto, which goes along with not having a seatbelt law. By the way, if you all want to ask me a question as I go along, please just type in the question there or raise your hand for chat. And then you can see this slide, which is really pretty disturbing. The fact is that in 2008, the curves for deaths from motor vehicle crashes and deaths from firearms in the state crossed. And now we have more people dying in this state from firearms than we do from motor vehicle crashes. Although recently we've all heard in the last 2 years that motor vehicle crashes have increased, probably because of the increase in distracted driving of young people on their cell phones. But nevertheless, you can see that motor vehicle crashes have had a decline, by firearms have not. And the cost of gun violence in the country as well as in our state is really enormous. You can see here that the cost nationally is more than we spend on obesity and almost as much as we spend on Medicaid billing. And here in the state of Washington, a couple of years ago, I looked at the firearm injuries treated at Harborview, and you can see here that for 259 patients, $17 million was spent for the care of those patients, and 82% were paid out of government funds in the form of Medicaid or Medicare. So that, we as a state clearly have a stake in what happens in gun violence, just in terms of even the financial problems, no less the human factors of it. When talking about gunshot wounds, it's important to try to really disaggregate this and look at the different components of gunshots. So here in the state of Washington, you can see that 75% of the gun fatalities are suicides, while 23% are homicides. And the fact that so many are due to suicides is often frequently lost. Most people focus on the assault-related gunshot wounds and the homicides, but in fact, nationally, 63% of the gun fatalities are suicide. And partly it's obviously because the case fatality rate of gun suicide is very high. It's on the order of 85 to 90%. But the fact of it is that firearms are a common reason that people choose to commit suicide. You can see here that unintentional, sort of the things that we as pediatricians worry about, kids getting hold of guns and shooting themselves. There were 6 deaths from that in Washington State in 2015. And then there were 13 deaths from legal intervention, which are police shootings of citizens. Now let's first take a look at homicides. And the important questions here are, first of all, is the United States more violent than other countries? And how does the homicide rate vary with gun ownership? And does access to a gun increase the risk of violent death, which I think is the really key question here. First, in terms of, is the U.S. more dangerous, or is it a greater risk of interpersonal violence than other countries? And I think the answer here is no. Here is a study done a few years ago looking at teenagers in Osaka, Japan, and in Seattle. And you can see that, if anything, the teenagers in Seattle were less involved with fights than teenagers in Japan. And here is another graph showing the assaults reported to police per 100,000 population. And you can see that the United States, by far is not at the top of this group here. We're in sort of the middle, behind places like Scotland is obviously very high there. But we are not a more violent country, and similar to Canada there, as well as places like Israel. So that's really important when you think about the next slide showing the homicide rates. And you can see here that the homicide rates in the United States is much higher than any other of the high-income countries. I mean, look at it for Japan or Spain or Germany. And you can see that in this slide that this difference is really all related to gun homicides. The United States has the red bar here, you can see the United States has a much higher rate of gun homicides than do any other countries. Here in Japan, you can see that there were no gun homicides at all. So that that really reflects their strict gun control legislation in those countries. But because of that, they have obviously a much lower rate of homicide than does the United States. And that comes down to then how many guns do we have in the United States? We don't really know. That's one of the answers here. And there is no national registration of guns, unlike we have national registration. We have state registration of cars. So we know how many cars we actually have in the United States, but we don't really have any clear, definite idea of how many guns there are. This is really due to phone calls, doing phone surveys of individuals, asking them, do they have guns in the household and how many guns do they have. Generally recognize that there's probably about 30% of households, both here in the state of Washington as well as nationally, have guns in the homes. And those households that have guns tend to have more than one gun. But you can see here the United States has many more firearms in civilian possession than do any of our comparative countries. And because of that, there is a relationship between gun ownership and risk of firearm-related death. And here's a nice slide that was published a couple of years ago in the American Journal of Medicine, looking at down here on the x-axis the number of guns in households, on the y-axis number of firearm deaths. And you can clearly see that the United States here is really is an outlier for both of those in terms of the number of guns per household as well as number of fire-related deaths. And then you can see way down here at the bottom left, you can see Japan, which has almost no guns, and as a result has a very low rate of firearm-related deaths. And then looking at this by state, you can see here, here's the state of Washington and here, and you can see that, again, there's a pretty clear relationship between firearm deaths and firearm ownership. We see states in the southeast United States and some of the western states like Wyoming, Nevada, Arizona that have a high rate of gun ownership, and they have a high rate of firearm-related deaths. And then states in the northwest have a lower rate of gun ownership and a low rate of firearm-related deaths. Now, looking at the reasons why Americans have guns, this is again a phone survey, and this was done recently, and you can see that the most common reason that people own a gun is for protection, personal safety, the idea that they can protect themselves and their families from intruders and threats to their families. Second is hunting, and followed by a variety of other reasons. But this is really important because people keep guns at least primarily in part because of the idea that they want to have protection of their families. So the question is, are you safer having a gun in your home or not? So this is a study done by my friend Arthur Kellerman, along with the previous medical examiner for King County, Don Ray, where they simply looked at gun deaths occurring in the home in King County, you see, over this period of time. And they found out that there were very few self-protection, self-defense homicides in here. But there were a lot of particularly suicides, as well as some homicides and unintentional deaths. And you can see that for every time that there's a self-protection homicide, somebody using a gun for self-defense, there are 43 deaths to people in the home. So that ratio of 43 deaths to people in the home compared to one intruder death really, I think, speaks to the issue of, are you safe having guns in your home or not? And I think, as pediatricians, when we talk to families, I think this is important information to give them, that, in fact, it makes your home less safe and more safe. And then I think you all remember what happened in December of 2012, which was the Newtown shootings. And Adam Lanza shot 26 people, and all of his victims died. The trauma centers actually were not very busy that day because everybody died. Interestingly, I noticed in the New York Times the next day this story of a man that kind of went crazy and stabbed 23 children, elderly women in China at a school, and none of the victims died. So a real contrast there between what happened in the United States versus in China. And, people have said that President Obama has been the best asset for the NRA and for gun sales in the United States, because after the shooting, people were worried that the President and Congress would decrease their access to guns, and so as a result of that, membership in the NRA increased and gun sales actually increased. Let's see. Sarah Rafton just asked, are there regulations in Northeast United States to help with gun rates? And yes, there are, and we'll talk about that a little bit later. And the other startling thing was that 39 states after the Newtown shootings passed gun laws, but in 24 states the laws were less restrictive, not more restrictive. And I think that it's also important to realize that there are important racial disparities here when we talk about gun violence. For homicide, you can see that black males 10 to 24 years of age are much more likely to be victims of homicide than are white males, as shown in this slide. And Hispanic males lie between black and white males. But there's clearly a racial disparity here, and I think that that's important as we increasingly are conscious about health equity and inequities, that this really is a racial disparity in the gun homicide deaths. So you sort of take all of this information together. What can you conclude about homicides and guns? And I think what you can say is that the prevalence of gun ownership in the community has a direct effect on the choice of weapons that robbers and assailants use. And because guns are much more lethal than are knives, there are more deaths related to guns. And as I said, that there is really a racial disparity, as well as an area of income inequality, have much greater rates of firearm homicides. So what about suicides? And for suicides, the questions are really sort of similar. What proportion of suicides are committed with a gun? And importantly, what's the relationship of suicides to gun availability? If you restrict gun access, can you decrease the rates of suicide? So here in the state of Washington, you can see that overall, in this leftmost bar, you can see that there are about equal number of firearm suicides as non-firearm suicides. We deal mostly with this age group here, where you can see there's slightly more firearm suicides. But the group at greatest risk is actually people like me. It's males over the age of 65 at greater risk of committing suicide with a gun. I think both because of access and because of life changes and depression that result in the risk of suicide there. Now, this is data from one of our studies that I did with Dr. Kellerman many years ago, and you can see that we did a case control study looking at individuals where there had been a suicide death, as well as homes where there had not been a suicide death, and people in the neighborhood, and we found out that for 0 to 24-year-olds, having a gun in the home was associated with a tenfold increase in the risk of firearm suicide. Interestingly here, that having a gun in the home was markedly increased the risk of suicide among those that had no history of mental illness. And the other thing in these bullet points down here, you can see is that having guns not safely stored, kept loaded or unlocked, was associated with a markedly increased risk of firearm suicide. And we'll come back to that safe storage issue in a few minutes, but that's really a key for us talking to families about guns and gun ownership. And when we talk about guns and suicide and impulsivity, I think it's really important to realize that for many people, suicide is a very impulsive act. And here is a study that some individual did a number of years ago, interviewing people 13 to 34 years of age who had tried to commit suicide but lived, fortunately. And they interviewed them and asked them how much time was there between the decision to try to commit suicide and when they actually did the act. And what they found is that in 24% of instances, that the attempts were done within 5 minutes of the decision. 24% of the time it was done within 5 minutes of the decision, and in 70% of the times it was done within 1 hour of the decision. So really, for many individuals, trying to commit suicide is a very impulsive act. Now, we're not saying that these individuals don't have depression or other mental health problems, but we are saying that this decision to actually try to kill yourself is oftentimes a very impulsive decision that's done very quickly. And here's some data from California, where a friend of mine, Garen Wintermute, down at UC Davis, looked at what happens after you purchase a handgun and the risk of suicide. And here he showed that in the first week after purchasing a handgun, your risk of suicide has increased 57-fold. So clearly individuals in this circumstances are purchasing a gun to try to commit suicide. And that's really points to the issue of we need to try to do a better job of preventing people who have mental health issues from obtaining guns. Now, there's a lot of discussion in this field of research about means matter. The means you use to try to commit suicide matters. And here's the case fatality rates. I think it's no surprise to any of us that trying to kill yourself with a gun has a very high case fatality rate on the order of 85%. Occasionally people do it such that they don't die. Oftentimes they put their gun to the roof of their mouth but point really more straight upwards, get their face rather than their brain, so survive that. You can see that suffocation, hanging, or jumping from height also have a high case fatality rate. But what you can also see is that the case fatality rate for poisoning and overdose is really low. It's on the order of 2%. So the means you use to try to commit suicide really do matter. And just to walk you through this kind of a model of how, if we restrict lethal means, we might be able to decrease the risk of violent death. So if you have a less lethal means, for example, just pills to try to commit suicide, fewer attempts are going to be fatal. And the important thing here is that because suicide oftentimes is an impulsive act, that the fact is that 89 to 95% of people who try to commit suicide do not go on to die by suicide, which is really, to me, startling. Obviously, some people persist and really do end up killing themselves, but that's a vast minority of people, and the vast majority of people really end up surviving that suicide attempt. So if we can help prevent that first attempt from being fatal by obviously restricting lethal means, we can really help to individuals and prevent them from committing suicide in the long run. Now, here's an interesting study that I came across. Many people point to Israel as saying, well, in Israel, being in the military is mandatory, and individuals in Israel can take their guns home with them on the weekends, and it doesn't seem to be a problem. Well, in fact, it was a problem, and the army in Israel decided to decrease access to guns by preventing the individuals from taking guns home with them on the weekends. And you can see as a result of this, there was a decrease in suicide by 40%. 40% decrease in suicide, and almost entirely eliminating using firearms to commit suicide over the weekends. Now, one of the questions here is their analogy to guns on college campuses. The first really mass shooting in the United States happened 50 years ago when that individual went to the University of Texas bell tower and killed, I think it was like 25 or 30 people with a rifle. And after that, I think we became really aware of the problem of guns on college campuses, and most states forbid guns on college campuses. Well, 50 years to the day, the state of Texas, the governor signed into law allowing colleges to students to again have guns on college campuses. 50 years to the day after that mass shooting in Texas, and I really worry that that's going to result in an increase in suicides among individuals on colleges. Now, here's the effects. So Sarah had asked before, are there regulations that affect the risk of gun deaths? There aren't any. I don't think there's any one legislation that has a huge effect. I think it's really a matter of trying to chip away at the problems. So the waiting periods that have been associated with lower rates of gun suicides, not overall suicide rates. Universal background checks have been associated with lower rates of both overall suicides as well as gun suicides. And then restricting open carrying seems to be associated with lower rates of gun suicides as well as homicides. And you can see here in the little table here what happened when in California, District of Columbia, and Oklahoma, they passed these laws, and you can see that there were some small changes in suicides, but I think most striking was what happened in South Dakota when the waiting period was repealed. You can see that there was almost a 9% increase in the risk of suicides after the waiting period was repealed. Again, based on those slides I showed you, that suicide is very impulsive, and many individuals purposely buy a gun because they want to commit suicide. So if you put all of this information together, there seems to be a strong association between gun access and risk of suicide. That means do matter, and means restriction appears to work because it's not a complete substitution with other lethal means. So in other words, if you restrict guns, there aren't going to be other lethal means that people use to necessarily commit suicide. And finally, the unintentional injury problem. I just wanted to, us as pediatricians, we're interested in this, and you can see that it's actually relatively small problem, that many of these deaths occur at a friend's house and with a family member as the shooter. You can see here is that the vast majority of these deaths happen with the 61% happen with a family member was the shooter. And you all know the scenarios here. Typical 9 or 10-year-old kid goes with his friend, finds daddy's gun in the closet or the bedside table, and they play around with it, and it goes off, and they get killed as a result. So what can we do about this? This is one of my favorite quotes that Abe Bergman gave me to this: rhetoric without action is froth. So what can we do about this? So it's important to realize that there are big gaps in the federal gun policy. Remember the slide I showed you, I began with, about the decrease in motor vehicle deaths. Well, we have licensing of motor vehicle drivers and we have registration of motor vehicles, but we have neither of those for guns. We also have the federal government maintains a national database on all fatal motor vehicle deaths in the United States. It's called FARS, Fatality Analysis Reporting System, which we use a lot here at the Injury Center and other people use to conduct research on and figuring out what are some of the important causes of these deaths. But there isn't any equivalent of that for guns. Most states do not have a limit on the number of firearms that may be purchased, and there's no mandated waiting period. So what can we do then to try to reduce the rate of gun violence? I think safe storage of guns is really pretty critical, and we'll talk a little bit more about that. Universal background checks. So I think all of us are aware of I-594, which was the state initiative that was passed after the legislature failed to pass this, and it required a universal background check. I think before that, there was the so-called gun show loophole, where individuals at gun shows or any private transactions could sell guns to another individual without any paperwork, without any kind of a background check being done. This last year, in November, the state passed another initiative. It was 1491, which was the extreme risk protection orders. So we now in the state of California both have this law, and the idea here is that if you or a family member and have another person in the family who you're really worried about is mentally ill and you feel like they have a gun and be at risk of harming themselves or others, before this law there was really nothing you could legally do about that. But now, because of the law, you as a family member can go to a judge and they have a formal hearing, and the judge can decide to temporarily remove the gun from the individual's possession. So this was really done in California. You know, there's a terrible circumstances, a response to an individual who was mentally ill and went and killed a number of people as a result of having a gun. And his family tried to get the gun away from him, but failed to do so. So we're hoping that this will try to protect individuals. The ban on assault weapons and ban on sale and possession of large capacity ammunition magazines is really important. I think we all remember about a year ago there was the shooting up in Mukilteo, where I think it was about a 20-year-old individual had gone to a party and shot a number of his friends up there and killed a number of them. Well, it turns out that this individual, because he was less than 21 years of age, he was not allowed to buy a handgun. You have to be 21 in the state of Washington to buy a handgun. But he was able to purchase an AR-15, an assault rifle, and you only have to be 18 in the state of Washington to buy an assault rifle. I mean, it seems obviously pretty crazy that you can buy an assault rifle but not a handgun in the state of Washington, given your age. This issue of personalized guns, so this issue of personalized guns is the idea of, can you have guns which are somehow the technology is able to prevent it from being shot by somebody else. For example, it recognizes your fingerprints. And then I think most importantly is where we can really work, which is changing norms around gun possession. Again, looking at those slides I showed you about, is it safer to have a gun in your home or not, that it looks like the data would seem to suggest that it really isn't, and so counseling families about that. Well, one of the things we as pediatricians here have been very involved with has been safe storage of guns. This is a study published in JAMA a number of years ago. It was done by David Grossman, a former pediatrician here in the state. And David looked at households where there had been a shooting and compared them to households that had guns but not having a shooting. And you can see here that having guns being safely stored, meaning that they either had a trigger lock or in some kind of a gun safe or gun lock box, was really remarkably effective in reducing firearm suicides, accidental shootings with long guns as well as handguns. So safe storage really does work. And David also conducted this study up in Alaska. So we all know that up in Alaska among native villages that guns are present in all households, and they're used for subsistence hunting as well as for protection against predators. So they're really a part of native life up there. So David did a very interesting study where he actually got some additional funds, and he did a randomized trial in remote Alaskan villages where the only way to get in was either by boat or by plane. And to a group of villages, he gave gun safes, and then to other villages, they didn't. And before and after, they went and looked at how many guns were stored safely versus not. And you can see here the intervention group is the blue bars and the control group are the red bars. And after the intervention, you can see that the number of guns that were unlocked or ammunition unlocked or both unlocked was much lower in the intervention villages than not. So even where guns are really a part of the culture, emphasizing and providing means to store them safely really can be very, very effective. And here's a study that I think should give us pause as pediatricians. It's a study that we did a number of years ago. It's a big national study that was done in the United States, surveying about 11,000 adolescents, 13 to 18 years of age. And we found out that they asked not only about mental health, but there's actually a couple of questions in there about whether or not there was a gun in the home and whether the kid could have access to it. So you can see up here at top that 30% of individuals reported there was a gun in the home. 41% reported they had easy access to it. What was really disturbing was the fact that individuals that had a lifetime history of mental health disorder or substance abuse disorder had as easy access to guns as those who didn't have those problems. So this is really where we as pediatricians need to be involved. If we see a adolescent that's having substance abuse problems or depression, which we do see, is to really counsel the family about either getting the guns out of the home for a while or making sure that they're safely stored. And I think as many of you know that Seattle Children's has been sponsoring some gun safe storage events. Many of you may not know the reason for this. In the Marysville shooting, Cindy Gizek, who's one of the senior vice presidents at Children's, one of her nieces was killed in that event. And that really, I think, shook her up as well as other members of the children's community. And so they have been sponsoring gun safe storage events. We just held one a couple of weeks ago up in the Cabela's up on Route 5 north of Seattle near Marysville. We've held these around the states, and we have found that these really have been very successful. There are lines that go out the door that we usually start giving away the things at 10 o'clock in the morning. People start lining up at 6 a.m. to get these gun lock boxes. And we find that they are effective. So here you can see, looking at the household firearms locked, you can see that there was an increase in that. Household firearms unloaded, and all firearms stored, locked, and unloaded, you can see that there was an increase in that. So that this gun safety storage events seem to really be effective and be important, and I urge you to think about having these in your community. I think if you're interested in that, you can contact Tizzy Bennett or Cindy Gizecki and trying to have one of those in your community as well. We've had them around the state. Now here's a direct answer to Sarah's thoughts about the laws here. And you can see that there's a good relationship between the strength of laws and firearm deaths. The strength of laws, the Brady Center for Handgun Violence rates the strength of firearm laws in the state. And here we are up here in the state of Washington. You can see we're kind of in the middle of the pack here. But you can see that states that have stronger laws about handgun purchasing, how many guns you can have, waiting periods, all of those sorts of things, there's a series of laws that really can make a difference. And those states like Massachusetts and California have had those kinds of effective laws passed, and it has resulted in low rates of gun deaths. And here is our state up here. We get a C in the scorecard in this, by Brady Center. Smart guns, I mentioned this earlier. There are different ways that these can be constructed by magnetic rings or by biometric sensors like fingerprints. Well, unfortunately, there's opposition to these on both sides of the aisle, so to speak. That gun proponents say, if I really need to use the gun in the middle of the night to ward off an intruder, is it really going to work, or is it going to fail? The gun control advocates say it makes guns seem safer than they really aren't, and will probably have a negligible effect on gun violence. There aren't enough of these guns out there. They are been manufactured, but they haven't been selling very well. So it's hard to tell whether this is going to be effective or not. I think the big challenge for something like this would be is how do you retrofit existing guns out there? If we have 300 million guns in the United States, the clear need is to retrofit those guns that already exist. And sort of this slide here I think is important. This was published in the Annals of Internal Medicine a couple of years ago, almost 2 years ago to the day, and the American Academy of Pediatrics was a member of this. And you can see here is that calling on ourselves, our legislatures, both state and federal, to really try to address the gun violence problem. So I think that's it, and I'd be happy to answer any questions. So I see a question from Heidi Kendall. In Montana, we find that saying gun violence prevention policies is more well received than saying gun control. I think that's really true, and I think that what our our safe storage event at Children's is preventing gun tragedies. And I think that in terms of even approaching families about safe storage, I think that we shouldn't be so much focusing on trying to get guns out of the home. I think that would obviously be good, but I think what's really where I think we can have a discussion with families is about safely storing guns, because I think everyone would agree that guns should be safely stored. Are there any other questions? I see Kathy Munson is typing here. Looks like a number of people are typing, so we'll give them a minute here to come on and put the information in. We can take these questions.
In the meantime, since I have a voice while people are typing, would you, you said this in your talk, but I think I can get it from what you said in your talk, but one or two most important things that pediatricians or primary care providers that take care of children should be doing in their office based on your research and knowledge of the topic, like little changes that we could make that would have the most impact?
Well, I think that it's the issue of gun storage. You know, I know, I'm very aware that your time with families when you're doing well child checks is really precious. I think the group to really focus on would be the school-age kids, and that families to approach it like you do other things. You ask about, does your child wear a seatbelt? Does your child have a bicycle helmet and use a bicycle helmet? Do you have guns in the home? And if so, are they safely stored? I think that that's really the way to approach this. You know, making it as part of what we do as pediatricians. And most families, when there's been some surveys with families about this, and most families do think that it's appropriate for a pediatrician to ask about this. There was the whole law in Florida about basically trying to prevent pediatricians from talking about guns, but that's never been enforced to my knowledge. And so I think it's perfectly legal for us to talk with families about guns. Kathy Munson wrote, sort of agreeing with Heidi, that it's no accident we are the Alliance for Gun Responsibility. That's right. We're really talking about responsible ownership of guns. Kerry Horthcock asked, can these slides be used by others to talk to family practice residents? Definitely. So Sarah says they're recording this webinar. It can be used with family practice residents. And I'm happy also if anyone wants to email me, and I'm happy to provide the slides to you. My email is F as in Fred, P as in Peter, R, FPR at uw.edu. It's FPR at uw.edu. And Cheryl Barron, Elizabeth Mead says, as a hospitalist, I frequently admit suicidal kids and teens. I'm surprised how many of them are already in mental health care as outpatients. I've never been asked if there are guns in the homes. I think that that's unfortunately true. How can we best work with outpatient mental health professionals to ensure that kids with mental health issues are being asked about home access? Well, Elizabeth, this is a good question. So I have a friend here in the state who lost her husband through gun suicide, and she started a program called Forefront, and they actually have passed a law now, which we all are going to have to do, which is that we all are going to have education about suicide. It's frankly going to be somewhat burdensome. It's going to require, I think, 6 hours of education for all of us to take. I know that Children's is trying to figure out putting together some online modules that we can all use to meet those requirements, but it's going to be a requirement for our licensing that we all do that. And it certainly as part of that, there's going to be education about this whole issue of handgun access and sort of preventing kids from getting access to guns that are depressed. Cheryl Berenson wrote, AAP has written education outlines based on patient age for providers, I think. Okay, and Julian put in my email address here, and Kathy Munson said, are there any other studies that demonstrate effectiveness of safe storage education programs from a data-driven perspective? There have been some earlier studies looking at the effectiveness of pediatricians doing counseling. And it looks like that the most effective programs are those that are where there's counseling accompanied by giving out a device. Trigger locks are really pretty cheap. They're on the order of $10 or more. The gun lock boxes are more expensive, about $90. And so that's why I think these events we're having are really critically important. There's also the Julian and others in the chapter have been active in the state in trying to get something called child access prevention laws. So there are states that have laws that make it a penalty if a child gets access to a gun in your home and uses that gun to harm somebody else. Well, there are two kinds of laws. There are those that make it a misdemeanor and those that make it a felony. And it looks like that the ones that make it a felony are particularly effective. Julian, do you want to say anything about your efforts to try to get those passed here in the last year or two?
Sure. It's been on our advocacy agenda for the last 5 years and has ran up into, like many things revolving around guns, ran up against significant opposition down in Olympia, but we're chipping away and making progress, and there's more and more bills being heard down there. This year, there's a kind of a unique take on it, kind of trying to build off the progress from the initiative that passed by almost 70% last year on extreme risk protection orders. It's being wrapped in addition to children, also people that are prohibited from possessing firearms. So the legislation that was being proposed, House Bill 1122, I think, is on dangerous access prevention, and we've been partnering with the Alliance for Gun Responsibility on working on getting that through.
Right, and I think that, as Julian just said, that there's been a nice partnership between our chapter and the Alliance for Gun Responsibility here, really both working together. And the Alliance for Gun Responsibility has been successful twice now in terms of getting state initiatives. Both of those initially tried to go through the legislative process and failed. So, we'll see what happens, whether this will end up being a state initiative as well. They're trying to be careful about which initiatives to do. And here's Kathy Munson saying, we are making progress. The Dangerous Access Prevention Bill was heard in House Judiciary 2 weeks ago and be heard in executive session today. So, there really is hope. And as I said at the very beginning, is that the action is really at the state house level. It's unlikely that there's going to be any congressional action there. And we're fortunate living in this state. As I mentioned earlier, Congress 20 years ago basically forbid the CDC from funding any gun research, partly based upon the work by Dr. Kellerman and I. City of Seattle has actually funded the Harvard Injury Prevention Center to do 2 studies now on gun violence. We're actually doing a randomized controlled trial of adult patients coming into Harvard with gunshot wounds and giving them case management, social worker to work with them, connecting them to services over the next 6 months to try to prevent injury recidivism. So, again, I think we live in a really terrific state that is at the forefront of doing this. Seattle was the first jurisdiction in the country to fund gun research.
I'd like to thank Dr. Rivera for spending time with us this morning and going through such a great presentation, and thank everyone for joining us this morning. If there's not any last-minute questions, start typing if there are. I just wanted to point out that it just happened that this week we have 2 back-to-back webinars. There's a webinar tomorrow morning at 7 o'clock by Dr. Evans, Yolanda Evans, on HPV cancer prevention. And so if anybody wants to spend 2 mornings in a row with us, that you can still register for that. And again, thanks for everyone for joining us, and have a great rest of your day.
Thank you very much. It's really been a pleasure to do this with you all. And again, I'm happy to share the slides with anyone who emails me. Take care.